"Hi, we're very much looking forward to seeing you for your rhinoplasty soon. The next time I'll see you is when you come in and I see you on the ward in your room. At that stage, I'll ask you to sign a consent form. The consent form details the name of the operation, which of course is a rhinoplasty, the intended benefits and the risks. You've got from us an operation plan, and this details what I'm aiming to achieve for you, and it also lists all the risks that we've discussed. When you were here, we also talked about the unpredictability of surgery together with the limitations. If you have any concerns or confusions related to any of what you've been told, please do get in touch with us and we can either ring you or we can see you again back in the clinic. Remember, the patients have an admission pack, which, as well as having the operation plan I've just detailed, and it also has instructions on what to do beforehand and what to expect afterwards. What would you like to emphasise and repeat again?
I think there are two main things. It would be the fasting instructions before they come in, and also the prescription to take to help prevent infection. And you just need to take that to your pharmacist 2 weeks beforehand, because not all pharmacists have it in stock and they might need to order it in.
Okay, so the prescription's the important bit beforehand and the fasting. What about afterwards? What am I going to feel like?
I think pain is unusual. It's more discomfort, and that's because you've got a blocked nose and your nose runs more and it is difficult to breathe through it, so you get a dry mouth, you need to keep up your fluids and you're just going to feel discomfort.
Okay, so I feel like I've got a heavy cold really,
Absolutely.
don't I? Okay, thank you. If I feel like I need to take something to help me, what would you advise?
I would advise paracetamol and ibuprofen, but
Okay.
you need to ask your pharmacist.
Thank you. If my mouth feels dry because I can't breathe through my nose very well, what do you suggest I do for that?
Just keep up your fluids.
Okay.
Is most important.
Okay, I think sometimes drinking through a straw helps too, doesn't it? Because the upper lip can feel a bit stiff.
I think so,
Okay.
yes.
All my rhinoplasty patients will have a dressing on the outside of their nose. Those who've had ear cartilage used will have an ear dressing, and if we've taken rib and chest dressing, and some patients might have little clips in the scalp if we've used fascia from the scalp. What do you advise about dressing care?
It's important that they're all kept dry, but the scalp one, you can wash your hair after 24 hours, but you would need somebody to give you a hand with that.
Okay, I think it's important to make the point that you can have a bath, you can have a shower, but if you're going to have your hair washed, someone else needs to do it for you with your head backwards over a basin.
Exactly.
And I also say make sure the bathroom's well ventilated, because steam in a bathroom can affect the dressings too.
Okay.
I advise against not blowing the nose for the first week, as this can make it bleed. A little bit of bleeding is normal, but blowing can aggravate that. Sniffing is better, and I say don't be worried about sneezing as long as you sneeze with your mouth open. I think after surgery it's good to get up and about, get outside, get some fresh air, but obviously avoid the gym for a couple of weeks.
I would agree with that. I think it's important to get out and about.
Any last comment, Emma, you'd like to make before we look forward to seeing everybody?
I would just like to say that the details of your follow-up are in your admissions plaque, so please make sure that you've read that and you know exactly when you're coming back to have your dressings removed.
Great. See you soon.
Bye-bye.